Hi HAI friends, Henrik here at the 2020 HAI Virtual Global Conference. We are making our way to pay a visit to the conference exhibit booth of our gold sponsor, Pharming. And as we walk up to Pharming's booth, we can see that both the Chief Executive Officer, Simon de Vries, is here, as well as Don Abramo, the Senior Director of Marketing, to speak with us today. I'll just say hi, Simon.
Hey, Henrik. Nice to see you. And first, I would like to thank you guys, you, Tony, the HAEI and the HAEA, for this opportunity to speak directly with you all. We at Pharming fully recognize the wider world, and especially the HAE community, are enduring a very difficult time right now. So we are especially grateful that the HAEI and HAEA has afforded Pharming the opportunity to speak directly with you today.
Perfect, Simon, and thank you for opening your virtual booth to us and giving us the opportunity to ask you some of the questions that we hear from HAI friends. So first, could you share the company's philosophy and principles with us?
Happy to do that, Henrik. Pharming is a specialty pharmaceutical company developing innovative products for the safe, effective treatment of HAE and other rare diseases with unmet medical needs. We are committed to transforming the future for our patients. As you know, we launched our first product, Ruconest, for HAE. Additionally, we are actively engaged in research and development and are at various stages in 5 clinical areas with high unmet medical need, including COVID-19. Our company employees always put patients' needs at the heart of everything we do, and we constantly seek better ways to serve the HAE community. That need is obviously heightened in times such as we are experiencing today with this global pandemic.
Yeah, and speaking about the global pandemic, we recognize that COVID-19 poses significant challenges to doing business in general. Do you foresee any impact on the continued supply of HAE medicines from your side?
Well, I can answer that question, Henrik. Our top priority, be assured of that, during the ongoing COVID-19 outbreak is the HAE community, our employees and their families, obviously. We've heard your concerns about supply of HAE medications. I want to let you know that we have recently received approval for a new production facility in the Netherlands to make Ruconest, our C1 inhibitor, indicated to treat the HAE swells. The new facility significantly increases the production of our therapy. Pharming now has 2 fully operating manufacturing facilities dedicated to producing a reliable supply of Ruconest for HAE patients in the US and globally. Because the C1 inhibitor in Ruconest is plasma-free, its production also does not rely on plasma collection centers. So at this point in time, we feel relatively good, given the circumstances, of course, the challenging circumstances. Additionally, we are in regular contact with all our manufacturing, shipping, and specialty pharmacy partners. Like all organizations, protocols are in place to protect our employees and ensure there's no disruption to the services we provide. The situation is obviously evolving rapidly. However, at the current time, there appears to be no issue or concerns.
That sounds amazing, Simon. Thank you very much. I can see Don Abramo joined us here as well. And may I direct a question over to Don for a second here?
Sure. Thank you, Henrik.
So Don, how does Pharming view the importance of working with patient organizations in advocacy?
Thanks, Henrik. There's no greater calling than to partner with an organization focused on helping diagnose and facilitate access to life-saving therapies, and in this case, HAE therapies. At every level of our company, we share a common bond on HAE and caring about you, the HAE patient. Pharming has been working with the HAEI and HAEA for more than 18 years. And when we started, there's no one that could have ever imagined what has been achieved. We're also very fortunate to have worked with the entire HAEI and HAEA leadership team, whose caring, passion, and commitment is clear when we see what's been accomplished in such a short amount of time. As an HAE-focused company, we would not be here today if it were not for the association and importantly, your commitment and participation in our clinical trials. As many of you know, there were no products to specifically treat HAE more than 10 years ago, and now there are 7 with more on the way. So the strong collaboration between HAEI, HAE patients, and industry has led to an unbelievable transformation from what was also not that long ago a neglected condition, and it's something that we should all be proud of.
Thank you, Joe. Thank you, Don, and thank you for the kind words. We appreciate the partnership and cooperation with Pharming just as much. Shifting quickly back to Simon again. Simon, could you share Pharming's vision for HAE in the coming years, including ongoing clinical trials?
Absolutely, Henrik. Our ultimate vision is to cure HAE. Science and our understanding of the human body and the conditions which affect is evolving faster than ever, as you know. As we advance towards the objective to cure HAE, we, like many other companies, will seek ways to improve the therapies and services we offer, which includes work ongoing within Pharming on RUCONEST to improve RUCONEST further with regards to the convenience side of RUCONEST. And of course, we are also interested in discussions with other companies who we can partner with to bring new, more convenient and effective HAE therapies to you. So we are very active actually in this front. When we have more information to share, of course, the HAEI and the HAEA and you will be one of the first and certainly most important groups that we will share this information with. My personal commitment to you, though, is that the whole Pharming team will continue to work very hard to end the pain and suffering that HAE causes. Thanks, Henrik, for this question.
And thank you very much, Simon, and also Don, for participating today. We want to thank you both for that, for everything you do, and for your ongoing support to our community. Thank you.
Great pleasure, Henrik. Good conference. Thank you.